Hi, my name is Dr. Samuel Harmon, and I represent Community Physician Network, Ear, Nose, and Throat Care. Well, basically how I explain it to patients is it's a device that I can use in surgery, and it's basically a GPS for inside your head. Through the use of a special CT scan and a computer, we can reference that to you in the operating room. I can take an instrument, put inside your nose, and within a millimeter of accuracy I can know exactly where that instrument is through the entire procedure. And because of the tight confines of sinus surgery between the brain and the eye, that gives us the ability to do a better job and a safer job of taking care of what needs to be taken care of inside your nose. Well, the image guidance doesn't really save you much in recovery. What it does is allows you to do a more complete job in a safe manner. The techniques for fast recovery have already sort of been worked out in that arena. We try to do the minimal amount of removal of tissue so that the healing process is quicker. We also use something called platelet gel, which is something we make from your own tissue. It's like tissue glue, and it has growth factors in it. It reduces swelling and it speeds the healing of the tissues and the surfaces inside the nose, and so it shortens the recovery time. Typical recovery is about a week, but people aren't down for that week, but they feel like sort of like you have a cold. First couple days they feel really good, then they get a little more congested and have trouble, with that, and then they come and see us and we take care of that, and then they feel pretty good. I do have one gentleman who came back after having all this done, and he was one of my early patients using the navigation, and he said, "Doc, I hope it's okay if I went out and played 18 holes of golf the day after you did this." He said, "I felt so much better, I couldn't resist." And he was fine, so I said, I guess it didn't hurt anything. So we have some people that really don't have much trouble with it, and a lot of people don't take any pain medicine because they swear to me it doesn't hurt. They're typically treated by the family physician for sinusitis, and they don't come and see us until it's a prolonged issue. And the first thing you do is a history and a head and neck exam to make sure that you don't find any obvious causes. You want to make sure they don't have allergies, because we can't treat allergies with surgery, so we want to address that beforehand and take care of those things, because oftentimes, I tell most patients, 50% of the time, I can solve your sinus problem without surgery by treating your allergies if you have significant allergies. So we go through all that, and once we've done that, if we're still not getting the results that we want, then we start talking about having surgery. We do an endoscopic exam here in the office, which is the same device that we use to look in their nose in surgery to see what their anatomy is like, and then obtain a CT scan to use in the computer-aided device.